Okay, so today we're going to talk about grief and hearing loss as part of the symposium here at the University of Chicago for the audiology department. It's going to be myself. My name is Marquess. I'm a first-year pediatric audiologist here at Comer Children's Hospital, and my colleague Katie, who's a social worker at our hospital as well. Here is our contact information. So like I said, my name is Marquess, first-year doctor of audiology. This is my phone number and my location here.
Hi, and I'm Katie Fitzgerald. I'm a licensed clinical social worker here with Comer Children's Hospital. I work in the audiology department as well as some additional outpatient clinics for pediatrics, and below is also my contact information. So today's learning objectives, by the end of this presentation, learners will be able to describe various stages of grief throughout the hearing loss diagnosis and course of intervention and treatment. Understand potential mental health issues associated with hearing loss and provide appropriate resources to patients. And understand the social work role within the interprofessional team and how social work contributes and supports patients, care, family systems after a hearing loss diagnosis. So let's start by understanding grief. What is grief? Grief is the normal and natural reaction to any kind of loss. Grief is a deep sorrow and can sometimes be a strong and overwhelming emotion for a person to experience. Some myths about grief. We only grieve when a person dies. Although grief is most commonly talked about in relation to a death of a person or a pet, a person can also grieve for many different reasons. Some of those may include, but definitely are not limited to, changing schools, a relationship ending, moving, a change in your job, or a change in medical diagnosis. Another myth is grief presents the same for everyone. This is not true. People can experience grief in many different ways. For example, someone may experience increased sadness, while another person may completely avoid all thoughts and feelings regarding the grief and act as if everything is fine. Another myth is it is better to not think about the grief. This is a myth because when we do not think about the grief, we do not allow time for ourselves to feel the emotions and think the thoughts or the feelings that help us process the grief and work towards our healing. Another myth about grief is people move on after grieving. Grief has no timeline, so some days may be better than others, but you learn to adjust with the loss. You may learn to cope with the loss, but that does not mean that you're still grieving and having harder days or still adjusting to the loss that you are experiencing. Elizabeth Kubler-Ross is well known for her theory on grief and the 5 stages of grief, including how a person may present in that particular stage of grief. The 5 stages are denial, anger, bargaining, depression, and acceptance. Denial is a state of shock. It can look like avoidance or thinking, I'm fine, becoming easily distracted, or it can feel like shock, numbness, and confusion. Anger is a strong feeling of frustration, irritation, and anxiety. It could look like sarcasm, irritability, aggression, or sometimes even increased substance use. It could feel like frustration, embarrassment, feeling out of control, impatient, or resentment. Bargaining is a line of defense against grief. It could look like ruminating on the future or the past, overthinking, perfectionism, having thoughts of if only I this, if only they did this differently. Those are some examples of what it could look like. It could also feel like guilt, shame, fear, anxiety, insecurity. Depression is empty feelings and deeper level of sadness that affects how you feel, think, and act. What it could look like is your sleep and appetite changes, reduced energy, reduced interest in your social life or your hobbies, lack of motivation, crying, in addition to increased alcohol or drug abuse as well. It can feel like sadness, hopelessness, feeling overwhelmed, just feeling really disappointed at times. Acceptance. Acceptance is learning to live with the new reality. What acceptance can look like is mindful behaviors, engaging with reality, can tolerate emotions. You're feeling vulnerable, you feel like you're adapting, you feel like you're coping. And what that can feel like is things are good enough, feeling courageous, you have some validation, you're feeling proud, you feel like you have some wisdom. So we just talked about these 5 stages of grief. Although grief has been broken down to the 5 stages that we just discussed, grief is not a linear process. One may experience grief in their own way and in no particular order or time frame. A little later, we will hear how these stages of grief may present for an individual or a family during their appointment. The social work role. As the clinic social worker, I work with the team in supporting our families emotionally, connecting them with community-based resources, navigating different support systems, and adhering to medical appointments. What this looks like is a family may experience barriers to care. That may look like having difficulty attending all the appointments, not having transportation, not being able to take off work. I can provide supports that support families in attending those appointments and overcoming some of those listed barriers. It can be difficult managing your thoughts and feelings. I am an emotional support person. We can talk about what those overwhelming thoughts and feelings are. I can provide support through the medical process. And I can also connect you to community-based resources that allow you to be connected with a mental health therapist for ongoing support. Another support may be advocating for your child in their daycare or school. If the school or the daycare are giving any sort of pushback or not allowing the needed supports and services for your child in their system, in their school or daycare, then I am someone who can communicate those needs with the school and be another advocate for your child and work with you as the family to make sure all your child's needs are met. How I get involved is the medical team would then consult the social worker and share the concerns that have come up in the clinic appointment. And I will then contact the family over the phone to complete a full social work assessment. From there, I will discuss with the family resources available and referrals that can be made and hope we can provide support to the family. If needed, I then stay in contact with the medical team and the family to provide ongoing support. Trauma-informed care, the co-occurring nature of trauma and outcomes. Increased presence of adverse experience leads to increased risk of depression, drug addiction, alcohol use and abuse, adult sexual assault, adult domestic violence, perpetrator and the victim, teen pregnancy and teen paternity, suicide, obesity, cigarette use, and general health problems. A lot of times, these are ways people experience their grief. And although you may not understand a person is grieving, these are some additional signs of how they are coping with grief and how to offer them support. Some triggers are the pain the grief is causing, feeling like they have no control of the situation, violating of their personal space, and just feeling exhausted from the experience and the grieving process.
Okay, so I'm going to take over now and tie in all that wonderful information from Katie to hearing loss specifically, touching on trauma-informed care, just being in the location that we are in here at the University of Chicago Medicine on the south side of Chicago. We do have a lot of traumatic things that come into our hospital. And so when parents come to our department, it's not necessarily near the trauma wing. A lot of family members have difficulty just being in our office alone to hear what we need to say and get through the next process of the hearing loss diagnosis. So that's something to consider when discussing hearing loss and other diagnoses with patients as well. So we'll start with hearing loss. So, since most of us that are attending this symposium are likely audiologists, we probably are all pretty familiar with hearing loss, so we'll keep it brief. We have types of diagnosis of hearing loss. So what's the degree of our hearing loss? So from normal all the way out to profound. Is it in one ear or is it in both? When are we diagnosing the hearing loss? You could be diagnosed as an infant right after birth, or within the first 12 months, during childhood, in young adulthood, or later in adulthood. And all of these different times and types of diagnoses can carry different forms of grief in both the patient and their caretakers. So let's talk about how grief can present itself in an appointment, like from the provider's perspective. So stage one would be considered the shock portion. So how will the family react? Is this really permanent? They're very shocked by the information that you're presenting to them based on the diagnosis. Stage two is recognition. This is the most emotional stage. The self-blame occurs here. A good example of this would be a mom or birth mother, let's say, whose baby was just diagnosed with hearing loss, and she starts to blame herself. I didn't take my vitamins, or I did this, that, and the other during pregnancy that caused this hearing loss. A lot of blame is pointed at other people during this stage as well. Stage three is denial. Patients here in this stage may ask for a second opinion. They may ask to take their hearing test elsewhere and begin shopping around. The shopping around term tends to be more in the adult category, just because based on how hearing aids work, and we all know with pricing and everything, and that tends to happen more in the adult population. And then stage four is just the acknowledgement and the constructive action. So here is where they're more open to discussing their options related to their own or their child's hearing loss. Sometimes these stages may spread across several different days or different appointment times, but sometimes, as a provider, there's not a lot of time for that, and all the stages may occur within the same appointment, depending on what your office layout is and how you present hearing loss and the next steps. So we'll start with from a parent perspective. Several emotions could come from this. Death grief is terminable, whereas parental grief is chronic. So I like to think of this as when someone passes away, grief never really ends, but there's a definitive closing chapter to someone passing away, where parental grief is chronic, meaning that the parents never truly get over some of these grief feelings that may come from different diagnoses. So like Katie had said before, we have guilt. This is especially notable in genetic cases, resulting in the diagnoses contracted during pregnancy. Any birth mother will tell you how guilty they feel based on anything that's wrong with their newborn baby. Hearing loss aside, just any type of diagnosis. Then we have grieving of the communication style. We learned a lot about this when we were in school. This is expected, especially if it's a profound hearing loss, and ASL is the chosen mode of communication. If you have two hearing parents that have a new baby that's born profoundly deaf, and they would choose to use ASL, or ASL is their only option for communication, now the family needs to learn a whole different language. So it could be grieving something that you weren't expecting. You have to communicate with your child in a way that you never pictured or never even thought about. Then we have appointment overwhelm. Information can be overwhelming and rush for time-sensitive intervention. So Appointment overwhelm, just simply having the diagnosis could be overwhelming, but many parents have had little, if any, experience with anyone who is deaf or hard of hearing, given that 90% of hearing loss or children with hearing loss are born to hearing parents. So we've all learned and discussed this with a profound deaf diagnosis, how to discuss communication options and resources with the newly identified profound hearing loss. We all know what the next steps are, including, potential cochlear implantation, routine device use, get those hearing aids on the kiddo, and even more testing that could follow just that appointment alone. This also includes the discussion of following with ENT, speech, occupational therapy, physical therapy, pretty much all the therapies. For some parents, I would even argue for most parents, this would be an unfathomable amount of information, and planning to take it all in at the time of a diagnosis, especially the earlier your child, if it's a baby, you're already overwhelmed with having a new life. So the appointments themselves can cause a lot of grief. Societal and familial expectation or stigma that comes into play with a lot of different intervention strategies. So what does society think of hearing aids? What are the grandparents going to think of my child that now has hearing loss? Or what is the stigma that comes along with hearing aids? Are they less smart? Are they less fast at learning? Are they, all these different things? Just because they're in hearing aids, what people may be feeling the pressure of those societal stigmas at the time of the appointment. And then we have other developmental stressors and pressures of parenting. And then you add on device use. So if your child has other things going on that's not simply just hearing loss, but other developmental delays, you have to take that in consideration too, that the parents are incredibly overwhelmed with everything that they need to do for their child to make sure that they're on the best track. And then the pressure of parenting in general, just for a typically developing kiddo, can be incredibly daunting for a lot of parents. And now we're asking them to wear hearing aids and wear them full time throughout their whole life. It's a lot to ask of a parent, especially in the first appointment. From a patient perspective, we'll start with a child just because we were talking about them already. A child could be concerned about having a stigma at school or being bullied for their hearing devices or being bullied when they ask someone to repeat themselves. The stress and pressure that can come with advocating for themselves, using their communication strategies or double checking with their teachers for their seating locations or just learning how to better set themselves up in the community. Then they have special treatments in school that could be stressful, meaning an IEP or a 504, or if they're removed from the classroom because they're getting speech therapy, how that could be stressful for a child. It is shown that children with hearing loss have higher depression and anxiety, higher rates, of depression and anxiety. And then when you compare that to their adult counterparts, adults who may have been hearing their whole life, they now have a hearing loss and they're grieving the physical loss of the sound as they remember it or have become accustomed to. So learning how to, hear newly with a cochlear implant or hear with hearing aids and how it doesn't sound exactly as it used to and the frustrations that can come along with that. Especially if they have concomitant diagnoses or injuries that may have caused the hearing loss, that just adds more with sadness and grieving that comes with that. So if they have an accident or if they have a diagnosis like cancer that may have caused their hearing loss, and then the guilt that could come along with that too of, if I hadn't have crossed the street at that time or whatever could be the case for their accident or, what have you. And then there's the societal stigma we've all heard of aging and how hearing aids make people look old. That's something common we hear in the clinic often. People don't want to look old ever. And so you're putting these devices on me and now I'm grieving and I'm stressed about the process of losing my youth. And now I'm going to look a certain way and people are going to think of me a certain way. So we put together some resources for the Chicagoland area. So for parents who have a recently diagnosed child, some great resources include the Illinois Hands and Voices or Guide by Your Side. And we did Northwest Indiana as well. Indiana Hands and Voices and Guide by Your Side. These websites are here for you. The Chicago Hearing Society Choices for Parents has a great website detailing information about different support groups in the area and people to reach out to if you're feeling any type of emotion. There's some really great resources there for people. The American Cochlear Implant Alliance Parent Support Group is also great for patients themselves, pretty much of any age. Illinois Deaf and Hard of Hearing Commission, Hearing Loss Association of America, Illinois Cochlear Implant Chapter, and the A.G. Bell support groups for people with hearing loss. And these are in-person support groups. And then just some forums and websites. Maybe you don't want to go to a support group, or maybe your patient's not interested in being around other people quite yet, but they want to read about it. Reddit is a great one for hard of hearing. It's a very large platform. The Hearing Tracker Forum and the Deaf and Hard of Hearing website. So these are all listed. Please feel free to send me an email. I have these HTML links on a PDF. And then these were our references. And here's our contact information if you have any questions or any follow-up at all. And again, just email me for that PDF of resources. Thanks for coming.